Hello, I'm Keith Martin, the Executive Director of the Consortium of Universities for Global Health, and welcome to today's webinar, The One Health Opportunity, a powerful mechanism to improve global health outcomes. And we have three outstanding experts today in the One Health field. The One Health field, an interdisciplinary platform of biomedical and non-biomedical disciplines that work to improve the health of people, animals, and the planet. And what's interesting, it can address both the social determinants of health and is actually vitally important to addressing the Sustainable Development Goals. This is very timely as we can see the spread of coronavirus around the world. So let me tell you about today's presenters, and we're very fortunate to have today Dr. Sharon Deem. Dr. Deem is the Director of the Institute for Conservation Medicine at the St. Louis Zoo. She is also the former director of the U.S. Fish and Wildlife Service, and Dr. Deem will talk about threats to global health, particularly key One Health threats. Next up, we'll have Catherine Mashalaba. Catherine is a research scientist at the EcoHealth Alliance and has been a top policy advisor at the International Union for the Conservation of Nature. And Catherine's going to talk about the value of One Health and particularly as it relates to the global health security agenda and other global health threats that we may not be fully aware of. And finally, we have Dr. Cheryl Stroud. Dr. Stroud is the Executive Director of the One Health Commission, and she's going to talk about why One Health is important and what we can do to be able to advocate for this important platform and why we should do it. So with that, I'm happy to turn it over to Dr. Sharon Deem. Dr. Deem, over to you.
Great. Good morning. Thank you, Dr. Martin, for the introduction and for allowing me this opportunity to kick off the webinar. I will be sharing the greatest threats to global health, and then my two esteemed colleagues will follow, hopefully with solutions to help us tackle these threats. And really, hopefully, as I present the greatest threats, you will be thinking from the perspective of the One Health triad. So thinking about human health, but also the health of non-human animals and the environments on which all health is dependent. I think it's important to start with the Anthropocene, so this current geologic period. And this term was coined in the year 2000 and put forward by Paul Crutzen and his colleagues. And it reminds us that we humans are the drivers of changes on Earth today. So we are drivers of some of the most significant and in many cases irreversible changes, and we may in fact be the greatest threat to planetary health. And in this graphic, we see the evidence that future geologists might use to define the Anthropocene. And these markers may include roads and microplastics or mercury from air pollution, radioactivity from nuclear weapons, and all the sort of indicators of human presence on our planet. And the Anthropocene isn't just a term used by a few fringe scientists. From The Economist to the journal Nature, the Anthropocene has been presented as we more fully understand how we humans may indeed be the drivers of global changes today. So that brings us to some of these greatest threats. And on this slide, we have the greatest threats to global health. And you will see the usual suspects of climate change and emerging infectious diseases and pollutants. And today I will spend a little bit of time on that third threat, the loss of biodiversity, which I feel is one of the greatest threats to global health, and it's often overlooked. In this slide, this is a word cloud I developed a couple years ago, and we use in a lot of our One Health classes. And I ask my students to find their favorite challenge today. And you see plastics and pollution and climate change and the loss of species are very high. However, you also see that habitat loss and challenges to food security, invasive species, wealth inequalities. These all are threats we deal with today. And, you know, I said this is from 2 years ago. If I made this word cloud today, coronavirus might have overtaken where Zika is. But we can see how all these threats are interconnected, and they all have health costs for human and non-human animals and the environments that sustain us. So what I'd like to do with my short time is do a little bit more of a deep dive into a few of these. And we really cannot talk about the greatest threats to global health or One Health without starting with climate change. So a number of studies have shown how climate warming has direct impacts on the human body, right? So organ systems throughout the body may be impacted. And we have similar studies from non-human species as well. And when we consider that 74% of the world population will experience deadly heat waves within 80 years, these health threats to individuals are all too real. But I would ask that we think of climate change from a more holistic One Health perspective and consider the possibly less tangible and indirect health threats that result, but are incredibly important to think about. So from the loss of arable land and food security issues to climate refugees and the spread of infectious diseases, all these impacts are interrelated and intensified by climate weirding as it continues. And I think a great poster child and case in point are the Australian wildfires of 2019 and 2020. The human health costs, as we know, are immeasurable, with 57% of Australians impacted. And this is from the loss of life to the loss of livelihoods and mental health issues. But additionally, 1 billion, and that's billion with a B, 1 billion animals have perished or died. And the actual ecology of the Australian continent has probably changed for the foreseeable future and definitely for our lifetimes. So climate change has impacts on human, animal, and environmental health. The second big threat is emerging infectious diseases, and this gets a lot of consideration in global health today. And for humans, we know that 75% of these emerging infectious diseases have an animal reservoir, and 70% of these have a wild animal reservoir. So these numbers are cited a lot and are significant. However, I would challenge us to think about why these zoonotic emerging diseases are on the rise. And really, contact with wildlife is increasing, and the trade in wildlife products globally is immense. Illegal wildlife trade is right up there with the drug trade, arms, human trafficking, and have similar economic profits. And it's not just a problem over there, it is a global problem. So we can think about the concern for biodiversity loss and emerging infectious diseases, and it's very clear in this concept of wet markets. And these wet markets are where live and dead animals and all kinds of species and taxa are mixed together and then sold for human consumption. And the coronavirus epidemic today has really opened people's eyes to these wet markets and the global health cost, right? So we need to be thinking about our changing relationship with wildlife and wildlife products. And again, this is not just a problem over there. This lower right picture is from a street in New York. So it is a global problem. And a wonderful paper published by Dr. Christine Smith and her colleagues a few years ago helps put some numbers on the scale of this trade when we look at illegal wildlife that was confiscated at U.S. ports. These numbers are staggering. But the loss of biodiversity is another threat that should be considered by global health professionals. We have lost 52% of our fellow vertebrate species since 1970. And for some of the same challenges or threats that we listed at the beginning. 1 million species are at risk of extinction right now, and we are in what is considered the 6th mass extinction event, and this one is being driven by humans. And this should concern us as global health professionals. I just want to point out one of the reasons for this loss is emerging infectious diseases in animals. So like our human species with emerging diseases as a global health concern, in the past few decades, these emerging wildlife diseases have also increased. And some of these, such as chytridiomycosis here in amphibians, have led to actual species extinction. And many, like the bottom two, white nose syndrome, colony collapse disorder, have real direct and indirect human health impacts. The 7 million bats we've lost in the North America since introducing the fungus that causes white nose syndrome has a real cost to the ability of bats to pollinate and control pests. But also, if we think about colony collapse disorder and the loss of commercial and wild bees, we can think about the loss of pollination and the ecosystem impacts. And from a human health perspective, this Time magazine article, which was really well done, reminds us that today, 1 of 3 bites of food we take, we need to think of bee. So if we're having these wildlife diseases and loss of species and population declines, it has direct implications for human health. So when we think of biodiversity loss as a greatest threat, which I put up right up there with climate change, we need to think about the loss of these ecosystem services that species provide us, the cultural, provisioning, regulating, and supporting services that humankind benefits from and will be lost with the loss of these species. If species go extinct, or if they're even just ecologically insignificant or extinct, we will lose these services. So thus far, all these threats, I think, really play into food security issues. A big question today is, how do we feed 7.6 billion and counting of us? How do we do this? And many studies recently have shown that meat consumption has increased by 50% in many countries. So the health costs associated with this rise are also increasing. And if we consider the billions of animals, the poultry, the pigs, cows, sheep, goats, all these livestock products we raise to make a meat diet possible, there are obvious health and welfare concerns for animals, but also for environmental health and increasingly for human health, such as when we think of the chronic non-infectious diseases of humans that are linked to the increased consumption of meat. I will end with one final challenge, and that is pollutants. And in particular, we're going to think about plastic pollution. And in the past decade or so, many studies have taken place on plastics in the environment and their impacts across scale, across species and environments. And there's a projection that there will be more plastic in the ocean than fish by 2050. So that's staggering in itself. But if we look at this slide and sort of the link with food webs, this is one area where we can see microplastics will move through the food web and end up being consumed by our unsuspecting character on the corner there that consumes the fish, and microplastics enters the person. And some studies that I've been fortunate to work on with colleagues looking at endocrine disruptors, especially bisphenol A or BPA, is on the impact that it has on reproductive fitness and health of turtles. And so in one of our studies we published, we exposed turtle eggs that were incubating at male-producing temperatures. We exposed them to BPA at levels that are in our river systems, and 33% of these turtles were feminized. So this BPA overrode the temperature-dependent sex determination and feminized these turtles. And although I do understand humans have a different mechanism than turtles for determining gender, studies are increasingly showing how endocrine disruptors impact human health. And data are coming out showing how earlier puberty in girls and menopause in women are actually linked with endocrine disruptors. Obesity and the human population, the obesogenic abilities of these compounds are also increasingly being shown. So plastics are a One Health issue. So in summary, with these greatest challenges, I really would like the global health professionals to consider global health from this more One Health perspective, and how these health challenges impact humans, animals, and the planet itself, and how they are all interconnected. If you would like a bit more, going a little bit deeper than my 12 minutes today, we have a textbook that came out, a TED Talk we did in 2018 that will cover in more detail some of what I've spoke about, but it is my great pleasure to pass it on to Catherine, and I thank you for your attention.
Thank you so much, Dr. Deem. You really set the stage for the challenges that we're facing as a global society and really the key needs for global health, whether it's for humans, animals, or our collective environment. I'm really excited to highlight some of the opportunities that we have in terms of solutions and how these can deliver, really new approaches to address the health challenges of today, but also into tomorrow. So bridging from what Dr. Deem was showing about the many different connections between our environment and our health, I think when we put it in the health security frame, we see that there's this really fundamental dependence on our ecosystems every day and then really globally, and the ways that our environments provide for us in terms of fuel, freshwater security, resilience against storm, and then infectious disease regulation too, and the many, many other free services that we benefit from. But these are really at stake with the way that we're rapidly changing our ecosystems. And then when we think in the tangible impacts in terms of human health deaths from what's typically attributed to the environment, we really have to think of this as unhealthy environment. So this is attributed to unhealthy environments, and this burden that we're seeing, this 12.6 million deaths per year attributed to these unhealthy environments, we're going to be seeing greater impacts on our health going into the future. And of course, this has an economic cost. We see right now with the novel coronavirus that, there's already projections about in the 50, 60, hundreds of billions to the global economy. But of course, at the local scale, there are often impacts that are really, dire for the communities affected. So losses in livestock, for example, losses in local industry, in addition to the human health impact. So we really have to be thinking about, maybe the global economy is a little more resilient and can rebound, but what's happening on the ground to these communities that are affected by zoonotic diseases, but of course, all the other challenges that Dr. Deem mentioned. So we really want to move upstream and from this reactive response that we see when there's a new health crisis to prevention. And this is really where the One Health approach and really approaches can offer wonderful value for health security. And there's a great opportunity to harness this upstream information where we see that there are these recurring spillover cycles and, look at what we can do for risk reduction before there is the spillover into domestic animal and human populations, and then also potentially in wildlife. I think this is a wonderful opportunity for addressing the biodiversity loss challenges and the drivers of emerging infectious diseases. And of course, just one example of where these sectors can work together and really form new partnerships. And we see that in terms of recent emerging infectious diseases from wildlife, the majority are really linked to the challenges for biodiversity loss. So these are things like land use changes, which of course can occur in many forms, but typically deforestation, extractive industries, really the contact opportunities that Dr. Deem talked about that are allowing for new exposures and these spillover events. And of course, with the novel coronavirus, we're seeing that right now, but it's not the first time to happen, and it certainly, unfortunately, isn't the last time to happen if we don't take collective action to take a One Health approach. And then, looking at those global drivers of a disease emergence, we then can downscale to the country level drivers and say, what's really happening in the context of the country? Where can we identify those really high risk interfaces for disease spillover? And then what are some of the sectors that we need to work with to address these threats? The Global Health Security Agenda is aiming to do just that. It's a partnership against global health threats involving governments. I think over 70 government countries have signed on, as well as the private sector, intergovernmental organizations, and NGOs. And academia. So this is a great opportunity to get involved. There are these action packages, which are really theme specific, so antimicrobial resistance, workforce development, surveillance, and of course there's a lot of synergies between these, and they're being implemented at country level in terms of these national action plans for health security, which are really intending to be a One Health approach, and a kind of a shared priority for countries to work together to address these capacity challenges. What I really think is encouraging about the global health security agenda is that we often hear about and think about the global health threats in terms of, you know, rapid mobility of societies and the way that diseases are spreading. But this is also a wonderful opportunity for the global health community to work together and share information and solutions across countries, to really help to prevent, detect, and respond more effectively, this sense of global preparedness, but it really takes all of us to do that. So I encourage you to get involved in the global health security if you're not already, and I'll share some resources on ways to engage. And again, here we see that when we think about prevention, detection, response, and we added in here recovery as well, because we think it's really important and often missed in terms of what do we do after the outbreak to really prepare for the future. But all of these different functions rely on many different communities, the security community, the law enforcement, when we talk about something like wildlife trade and reducing risk and deterring these really dangerous activities for biodiversity and for human health. So it really takes all of us. We may have a very specific piece, but it fits into this global health security and local health security puzzle. Now, when we do talk about One Health, I think there's this sense that it's, you know, one approach, but of course it's really context specific, and it's not always everyone working together all the time, although it's great to have an appreciation for these different sectors. But we really do need these strong environmental, animal, human health systems to determine what sector is relevant. And of course, other sectors are really crucial too, in terms of economy, in terms of, you know, tourism, and working with many different, sometimes non-traditional partners. But really the context about what is the global, the overall objective, what is the issue at hand, can help us guide where we intervene and which sectors need to be at the table. So we typically see this Venn diagram of these human and animal health systems, but we can look at it really in terms of specific diseases and see that maybe environment plays a larger role. Maybe you know, animal transmission is more critical, so we can target where to intervene. There's, I think, a great example with Rift Valley fever, because it really is this puzzle in terms of vector transmission, this amplification in livestock, and then spillover to humans. And we have rainfall patterns that really play into this, and soil ecology, and many different factors. And we really need this understanding of, you know, what are the specific puzzle pieces, how do they fit together, and then what can we do to work upstream. And then in terms of applying One Health approaches, this great opportunity in terms of national One Health coordination. We're seeing a lot of excellent strategies coming to fore in terms of countries developing these multi-sectoral platforms involving different sectors and meeting routinely, and really, you know, dedicating shared priorities and identifying, you know, their specific roles that each sector or agency plays, but seeing how they can really mobilize synergies for this shared vision. It is an all hands on deck sentiment, which I think is really critically needed and can help us to understand these issues more cohesively, and you know, not just emergencies, but also in peacetime. We have some great examples from One Health case studies, and if you're working on One Health approaches, I would really encourage you to write these up, share them, so we can have this knowledge base about what works, how it can be adapted to other issues and settings. This here is a specific example from the USAID Emerging Pandemic Threats Predict program, where there was detection of yellow fever virus in an animal for the first time in Bolivia, and it was able to inform really rapid public health action and preventive vaccination, and there were no human cases of yellow fever as a result of this outbreak, which I think is really powerful. And then also risk communication. This is an area in global health that we're, you know, really strong on, and we have these really effective communication channels and opportunities to get the message out but I think it's also an opportunity to make sure that we're really coordinating across sectors and have these coherent and consistent messages for communities. And in the Predict project, we developed a Living Safely with Bats book, which was an entry point to talking with communities. It was really specifically adapted to each country that we were working in and language, and our local teams would disseminate it and really respond to issues and questions in the communities to message about, the importance of reducing risk, but also ensuring that we weren't promoting risk reduction practices that actually had inadvertent impacts on the environment. So sometimes communities would say, okay, we're concerned about the bats, but then, do we go and cut down the trees and so that they won't roost there? So we really need this balance about, well, the trees are important and you don't want the erosion and you want the bats there actually for pollination, as Dr. Deem mentioned, but we, there are other ways that risk can really be reduced. And then in terms of looking into the future, so the projected impacts of climate change, for example, a really critical issue that we're facing. We see that the net detriment is really concerning around the world, and especially for those that are already in poverty and likely to be exacerbated by climate change. So many different health issues will be affected by climate change, but we really need a One Health approach to understand where these exposures will change, how we can mitigate them, how ecosystem services can really be part of that solution and nature-based solution. So I think, looking into the future, we can really use a One Health approach. This is some great work here from our friends at NASA looking at really prediction of events. This is about an 8-month lead time where they looked at El Nino forecasting and looked at where there might be health consequences and really areas needing enhanced preparedness. So we see, for example, in East Africa, increased risk of Rift Valley fever outbreaks, which can really allow time to implement vaccination campaigns. And then local health security too. So wherever we're working, whatever topic we're working on, this really call to action that we think about our environmental exposures. Certainly pollution is a huge issue, as Dr. Deem mentioned, but also we can use these global tools and projects like the IUCN Red List of Ecosystems, which is looking at risk of collapse, which is essentially the loss of ecosystem services, many health benefiting. And this image here on the right is the Aral Sea and its status in the 1980s, and then more recently, where it's really, from land use decisions, from water resource decisions, there's just complete destruction of this environment and, of course, loss of environmental services from it. So we really have an opportunity to mainstream One Health across sectors. These are examples from national action plans from all different sectors, disaster management, biodiversity strategies and action plans, the SDGs, but certainly locally in our communities and everyday work too, where we think about, there are land use planning decisions, is health being incorporated, how can we locally get involved? And of course, Dr. Stroud will show us more examples of that and how we can really mobilize. A few closing resources, if you're interested in getting involved in the global health security agenda, there are great ways for organizations and others to participate and really bring great ideas and creativity to this. These are a few of the ones that I work with. I'm sure there are others out there, but really, please do engage. And some additional tools and information, evidence syntheses, case studies, and some concrete guidance. But of course, we're always adding to this literature base, and I hope that you'll join us in that. So thank you so much, and I'll hand it over to Dr. Stroud from the One Health Commission to talk about how we can mobilize these partnerships and policy impact. Thank you.
Thank you, Catherine and Sharon, both for an excellent overview, and I really appreciate the opportunity for us to have this conversation really around the world, a really important topic, because to me, this is really urgent. We can't just continue to sit by on our hands. One of the take-home messages I'd hope everybody would get is that the collaborations that we need, that Sharon and Catherine have been talking about, are really not just in our current systems going to spontaneously happen. We really are going to have to create opportunities to form the relationships across sectors that we need. And for many of us, that will mean we have to occasionally get out of our comfort zones. So just bear that in mind as we finish this little webinar up. And I'd also like to point out that One Health is really a pathway not just to planetary health, but it's also a pathway to global security. We've been talking about global health, but we often don't realize that really global security is involved here also. If you think about how governments can be destabilized by either natural disasters or health emergencies like Ebola, or what's going on right now in the Democratic Republic of Congo. So just bear that in mind. I don't think we discuss it often enough. Part of our challenge here is that we as humans tend to think that Earth is the center of the universe and we're the most important species. And so we think it's our right to extract from the Earth whatever we need. And we're going to have to reframe our attitudes, really starting with education from cradle to grave, about how we really are just part of an ecological continuum, and that our decisions, we're going to have to find a way for our decisions, major decisions, to be based not so much on dollar signs, but on the bigger picture of health for our environment and for the animals in the environment. We often leave the animals out. So we'll touch on that a little bit more in my segment here. So yes, One Health really was, this movement really was first brought to us probably starting in the late 90s from the conservation and medicine and ecology sectors, pointing out to us all the zoonotic diseases that were coming from animals. And it's not that the animals are bad, it's that the humans were encroaching on their space. So that got our attention. And we've talked about that a little bit, but what we've learned over the past 10 or 15 years is that there are many, many arenas that are begging for us to do this One Health joining of hands to deal with some of our wicked challenges. So we've heard about some of these today. There's no way we can touch on all of them in any depth. I'm sorry we're not going to get to talk about vector-borne diseases any more than we already have, but I'd like to spend just a couple of minutes touching on some of the ones we haven't necessarily mentioned so much, like animals as sentinels and antimicrobial resistance. And we have mentioned disaster preparedness, but I'll touch on that again. So on the zoonotic diseases front, right now, I put this slide in here just this morning at 8:30. I created this slide just to make everybody aware. I'm sure there are a number of sites out there that are tracking what's going on with COVID-19. This is one I just discovered that Johns Hopkins Center for Systems Science is running. And so it's shocking to me every time I hear the numbers. The death toll has gone up another couple hundred. So it's going to be really amazing and frightening to see the economic impact of the current epidemic that's going on, and we're going to hope and pray that it doesn't turn into a pandemic. But I wanted to kind of put some, bring to the forefront some of the numbers of the economic losses. And this table that you're looking at now was prepared by Olga Jonas, who was for years at World Bank. She's now at Harvard. And so she hasn't even included deaths to our history of zoonotic diseases and the impact on the economy. She's just included case numbers. But notice again, we're talking US dollars billion with a B. And so the numbers that blow me away are that actually SARS was, the 40 to 54 billion. And I forgot to put the box around Ebola here. The number is actually larger, I think, than even what Catherine had queued up. And AIDS, which many people don't realize was originally a zoonotic disease, to date, $563 billion. And flu, which gets us every year, these are not even considering the public health and the deaths, but these are the economic losses. So I urge you to go find that paper and look at it. And just in case you're wondering, there are tons of publications out there about the economic benefits of a One Health approach. If you look on the One Health Commission's webpage under Why One Health, we're compiling a list. You could certainly search them, but in the interest of time, if you're interested to go see some of the publications, please go and look there. And if there are any publications out there that we've missed, please let us know. One of the things that I see as a huge challenge for us that we haven't yet mentioned today is antimicrobial resistance. We are concerned that by 2050, if left unchecked, antimicrobial resistance could contribute to the death of 10 million people. We know that antimicrobial resistant organisms are showing up in marine mammals in the middle of the ocean who have never been given antibiotics. And the assumption is that these organisms that have these little resistance DNA cassettes are exchanging their genetic material. It's coming from our waterways, from all the continents, from all the many places that we're washing antibiotics and these resistant organisms that are forming into our waterways, and they're ending up in our oceans. So the whole the global environmental impact of antimicrobial resistance, we're just starting to wrap our brains around it, including the soils. So this is where I think soil health is going to be incredibly critical if we're going to be able to feed 9 or 10 billion people on the planet. And the soil scientists and the horticulturalists and the plant pathologists are incredibly important for our One Health conversation. It's, we're now understanding that the microbial community in the soil is important as our microbiome or our microbial community in our guts. So these are conversations that we're not yet having, but they play right into what both Sharon and Catherine were talking about, food security. And if you look at the panel in the bottom right, something else that we don't talk about quite enough is food insecurity as a global security challenge. So these are just connecting the dots around all the sectors and how One Health could help us really prepare for this. The other arena that has been touched on is disaster preparedness. In the US, we had an incredible wake-up call in 2005 when Katrina hit. And we had people on their rooftops who would not leave with the rescuers because the rescuers would not take their pets. So we learned, don't show up without pet carriers. And it's really heartening to me to see a lot of our public health systems starting to pay attention and plan ahead for what's going to happen to the animals. And this is a global issue. We often are not paying attention to taking care of the animals and realizing that they're incredibly important for human health. I mean, we can't just leave them out of the equation, especially on the disaster preparedness and response front. We've had to learn this lesson over and over again. I don't know how long it's going to take us to put in place systems and regulations and formats that we're able to plan ahead for what's going to happen to the animals, because it can become significant public health issues for the humans also. And on this disaster preparedness front, something that many people are not aware of are, like here in the US, many people think they have this sense of security that, well, CDC is in charge and they'll take care of everything. But one thing many of us are not aware of is that CDC will never really be in charge initially when there's an emergency or a disaster. They have to be invited in. So initially, when something like this is going on, it's governors and mayors. And so how important is it for us to have those relationships in place between public health practitioners and the local governing officials, and who's going to communicate with the public about this or that, or who's going to make the decision to invite CDC in? So I urge you to think about these things on a local level and help put those relationships in place ahead of time. It's incredibly important. You might want to read Laura Kahn's book, Who's in Charge, to help you along the way. And so we've also mentioned the BPAs and the endocrine disruptors in our environment. I'd just like to real quickly mention this one about polybrominated diphenyl ethers that we were discovering in the 80s, cats that were being diagnosed as hyperthyroid. We never diagnosed hyperthyroid cats before. By the time I left practice to come do One Health work, I was diagnosing about one a week. And it turns out there was an association with polybrominated diphenyl ethers, PBDEs, flame retardants, in our environment. And a similar thing has been seen with perfluoroalkyl substances. You may have not heard them as PFASs. They're also endocrine disruptors and a lot of other things. And it turns out they're everywhere in our environment. They've been used on nonstick coatings, on cookware, and on many, many things. So these are the kinds of things that we're really going to have to join hands across sectors and share information and figure out what to do about. But many of us are concerned that we're using humans as sentinels right now. I would urge you to go and listen to Tracy McNamara's YouTube video on this particular topic. In most of our systems, if you look at the funding stream box on this, you can see that most of our funding for health and most other things are going to the human sector, with much, much, much less to agriculture, like almost non-existent to wildlife, and everything else, just a dot on the map. So this is really kind of an upside down equation for us if we are going to truly incorporate animals into our thinking. And also, if you go and listen to this, you will hear the West Nile story in the US, how Tracy was able to help identify West Nile in the US. And she points out, it's pretty scary, that we went for a couple of 3 weeks not knowing what this was, or if it might be a biosecurity threat that had been introduced. And why is this important? Well, 20 years later, it happened again with a flu outbreak in cats in New York that had jumped from people. So we weren't paying attention. In fact, Tracy points out that there is no governing agency that's in charge of all the animals in our environment, in local or in domestic or in wildlife situations. So what if that had turned out to be a pandemic like the 1918 flu epidemic that my own great-grandfather died in? What if that had turned out to be a pandemic and we were not prepared? Or what if this coronavirus really does truly turn into a pandemic? We're just not prepared. So what we're missing is right in front of our noses. It's the animals in our environment. So right now, what we're really looking for is the sentinels or dead people. So go and listen to Tracy's YouTube, because right now, and I'm sure this is similar in other countries, right now we're using taxpayers as sentinels for many of these diseases. We've got to change that. We are not ready. We've got to put systems and structures in place, starting at a local level and a governance level. This has really got to be a top-down, bottom-up movement for us. So what can we do? What can we do? And there is something that each of us can do. Many of you are familiar with One Health Day. It's very heartening to me to see One Health being taken up all around the world. That's very exciting because people are literally bringing One Health and One Health education to their world. It's all about education from cradle to grave, educating people, reframing their attitudes, figuring out ways to introduce education about One Health issues and the whole concept of working with others that are not necessarily like you, starting early and making this education. It's education. I hope that most of you are aware of the Outbreak exhibit that the Smithsonian has created that's at the Museum of Natural History in Washington, D.C. right now. If you can't get to Washington, D.C., don't despair. This exhibit travels. So please contact the Smithsonian. I'm happy to share with you the contact information. I see I forgot to put it on here, but you can communicate with the Smithsonian and bring this exhibit to a mall or a library or a university campus or a hospital near you. So I urge you to do that because it's an incredibly powerful educational tool for One Health, at least on the zoonotic diseases front. Some of our federal agencies in the US do have people within the agencies that are working very hard to reach across these sectors. The problem is, at least in the US, and I'm suspecting and guessing it's this way in other countries, is that the federal agencies often, well, don't ever talk to each other and become siloed because of funding streams and actual laws on the books that prevent them from sharing resources and money across. I could tell you a really kind of frightening story about CDC and USDA wanting to partner back when we were having an avian influenza outbreak here in the US, and they could come up with the funds for some sampling for the supplies that they needed, but they had no way to fund the people that it would need to go and do the project. And there are actually laws on the books prohibiting federal agencies to share resources for salaries. So some of those are, those laws were probably put in good place. That one was in 1933 for good reason then, but we've changed. We really have changed, and we've got to change with it. So I really would like all of you to be aware that here in the US, we do have some One Health bills that have been introduced into our Senate and our House. And so we've got groups that are working to try to raise awareness for that. We ran our Senate and our House passed One Health Awareness Month resolutions. And for January to be the One Health Awareness Month, and we ran a One Health Awareness Month campaign for around the world. Some of our states are actually setting aside One Health months and One Health days. So that's incredibly exciting. And I see One Health strategies coming out of many, many countries. So it's very exciting to see this being incorporated at government level, whether it's local government or national governments. I just want to remind you that One Health really is a pathway to both planetary health, and global security. And to remind you that the collaborations that we need at all levels of academia and research and policy, local government, national government, they have to start with relationships, which means that many of us as scientists, have got to climb out of our comfort zone and go get involved in getting the word and the education about science out to the public. That's what we've really, really got to do. I urge us to heal the past, live the present, and to dream the future. It really is up to us, those who get it about One Health, to go and do what we can in our local situations to dream the future about what we can be doing to actually implement and create One Health systems by default. Thank you so much. And at this time, I'll turn it back over to Dr. Martin for discussions.
Thank you very much, Dr. Stroud and Dr. Deem and Ms. Mashalaba. That was absolutely outstanding. We're going to go to Q&A right now. I have to do a mea culpa because I misrepresented Dr. Deem, who was not the former head of the U.S. Fish and Wildlife Service, but she is, as I mentioned, the director of the Institute for Conservation Medicine at the St. Louis Zoo and previously was at the Smithsonian. So that was absolutely outstanding presentations. And I'm going to, before we, for the folks on the line, and we have over 230 people centers around the world on right now, so thank you for joining us. Please send us your questions that you can online, and we'll get to as many as we can. So one of the questions I just want to ask is that, relative to what we're hearing today, is that we've seen environmental degradation. I mean, I think, Dr. Deem, your comment about we have lost 52% of all vertebrates around the world, which is shocking. So not only the larger mammals, but bees, birds, and worms are all being decimated with huge implications for our health and the security of nations. So a question is, what models have you seen on how we can integrate and mainstream conservation into development so that we can realize the benefits to both the environment and to human health, to protect those ecosystem services that are vital to our well-being and the security of any nation? And I'll put it out to all of you. So as a starting point, please go ahead and respond.
So I'll kick it off, but I am very excited to hear what the other two want to say. I think for me, as a wildlife veterinarian and as a conservationist, it was pointed out by both Cheryl and Catherine about the economics and how much money goes into sort of looking at the challenges that are facing other species besides humans. And yet, once we see this link, once we see this One Health link and how the health of the human species is so dependent on the health of other species that share the planet, I truly believe that is the first step in starting to make the mechanisms that will help us look at these challenges in a package and think about all of life and all the species. And I think I'll defer to Catherine and Cheryl to put it into perspective of some of the programs they spoke about today.
Thank you. I'll just add in quickly. I think, there are some processes that we're just starting to see some really tangible ways of implementing. So an example is safeguard processes before a development project is put into place, whether it's, say something supported by the World Bank or private development. So if we're looking at something like conversion of native forests to palm plantation, is there a safeguard process followed that includes both environmental impact but also health impact assessment? So we don't often, think about kind of what are the downstream health impacts in these processes. So we may be looking at loss of biodiversity and ways to mitigate that, or hydrological flows, but are we really thinking what it means literally downstream in the geographic sense, but also in 5 years from now, 10 years from now, when maybe that project isn't even productive anymore, or maybe that, priorities have changed in society, and so is that health consideration really built in from the start, and with the economic argument there, that can allow us to kind of weigh the cost and benefits.
Thank you, Catherine. And I would just add that we've really got to make sure that our lawmakers and policymakers understand all this, because we as scientists seem to think that if we do all this work and publish it, it's kind of like the baseball story: if you build it, they will come. And the scientists think, well, if we publish it, the world will find it and incorporate it. But that's really not the way it works. We're going to have to make sure that scientists and economists, really one of the points that I strongly like to make is that the social sciences, such as economists and such as social scientists, are incredibly important for making sure that we have this conversation. For example, there's a real conversation that we're going to need to have about these wet markets, and people are pushing to make them illegal, and that might be the way we need to go, but we're going to have to be very careful that we don't drive in a social behavioral aspect, that we don't drive more people to the illegal wildlife trade and drive more of it underground so that we couldn't regulate it. So those are the kinds of conversations that we're going to have that include the scientists, the economists, the social scientists, the lawmakers and policymakers. And this is where it can get really tangible.
That's great. Thank you so much for your responses. And on the last point, tying that to your comments, for all of our listeners, if anybody buys illegal wildlife products, you're actually supporting organized crime gangs and criminality. So that's a good point for all of us to remember. So, question from Elizabeth, and I'm going to give this to Catherine. Elizabeth wants to know, Catherine, do you have any good role models on how to incentivize local biodiversity conservation, for example, planting trees?
That's a fantastic question. I think it really is context dependent. There's not a lot of literature yet on this. I would encourage you, if you're considering research or involved in research, maybe to take this on. But I do think that we've seen examples in some of the communities that we've worked in where in stakeholder analysis, we're talking with hunters and getting a sense of the trade flows, and as they really start to think about, okay, wow, why are they interested in biodiversity? Why are they sampling? The way we sample is non-lethal, so it's really minimally invasive so that it's not stressful to the animal as much as possible, and really humane. And I think seeing that model in communities, people start to ask, why are you not killing the animal and taking it and maybe eating it or selling it? But I think just this awareness and changing thinking, I totally agree with what Dr. Stroud said about, you can't just shut down these activities outright. There are food security, there are economic considerations, but I think, working with local communities to see what are the alternatives, what's culturally acceptable, financially acceptable. I think it is really context specific, but we're starting to see some encouraging examples like that. Great question.
Thank you very much, Catherine. Cheryl, this one I'm going to give to you. It's from Dr. Jindal at the Uniformed Services University, and Dr. Jindal wants to know that there's no course or lecture on One Health in the medical schools often. Are you making efforts to ensure that there are courses on One Health in medical schools?
Well, the short answer is yes, and I am thrilled when I do see faculty at medical schools starting to pick up the One Health concept and incorporate it. We really have been trying very hard, especially on the student front, to get One Health into medical schools. Unfortunately, I can name on about the fingers on two hands the MDs that are out front leading from the human side of this, but I think it's really changing. So if you would like to communicate with me, I can point you to some of the courses that are out there that could easily be brought in. And as some of you know, in the U.S., public health is now mandated by the Curriculum Oversight Committee for Public Health to include One Health in public health. So it would be extremely exciting to see One Health courses actually incorporated into the curricula for medical schools, and I know those curricula are jam-packed full. So the alternative would be to have all the faculty incorporate One Health topics into all their courses. So thank you for that question, and help me make sure that that happens more.
Great. Thanks so much. Thank you, Cheryl. Sharon, this question I'm going to give to you from Katrina. As you being a veterinarian as well as an academic, Katrina wants to know, as a student looking to work in the field, what do you consider are the most important roles or functions of veterinary medicine in One Health?
Love it. Great question, Katrina. I would say top on my list is to have a passion of all these things we've talked about today, all the threats and the potential ways of coming up with solutions, the collaborative ways, the working across disciplines. But if you're at the undergraduate stage, I would say it's finding that discipline. And I can make any discipline fit into One Health, but you have to have that passion, and then you will find a role within One Health. So as you see, it's so diverse, these challenges, and it takes the economists, the politicians, the scientists, the veterinarians. So I think those are sort of, if I was at the start of my career, I would find what it is and then fit it in across that sort of multidisciplinary approach. If I could just add on to that, one of the things that we're doing here in St. Louis is we do, using the textbook, which is a 15-week semester course, we do have One Health incorporated into a couple of our universities, Washington University and St. Louis. And I think really getting folks from medical students, veterinary students, and lawyers and anthropologists and everyone to kind of have that background in One Health will really move us forward in building these teams of professionals across those disciplines.
Fantastic. Thank you very much. Yeah, go ahead, please.
So this is Cheryl. I was just going to add to that. I often have students come to me and say, how can I get a career in One Health? And it's just like Sharon said, pick your discipline, hone your skills, and then practice your discipline in a One Health way. So make sure that you're actually, whatever you find yourself putting your hand to in your work, make sure that you're doing it in a One Health way. And so for the gentleman who asked about One Health in medical schools, the textbook that Sharon shared with you, I've been reading it recently to write a review on it, and I can highly, highly recommend it. It would be a fabulous textbook to incorporate into the infectious diseases courses for medical schools.
Yeah, thank you very much. Thank you, Sharon and Cheryl. Just for everybody, that textbook is Introduction to One Health, an interdisciplinary approach to planetary health, and Dr. Deem is one of the lead authors and the person who started that textbook. This question, Catherine, is going to you from Dr. Wilson, and it's a fundamental question. People are often confused about the difference between One Health and planetary health. Could you tell the folks on this webinar what the difference is?
Thank you, Dr. Wilson. It's a great question. I see them really as one of the same. You know, sometimes the lens for planetary health is a little more in the public health side. I'm getting a PhD in planetary health, so I appreciate this a lot. But I think they're really complementary, and the more that we can show the synergies, because this is something that working with intergovernmental agencies, sometimes there is a lot of confusion on this, and at country level too. So I think as much as we can really create those synergies, reduce the barriers, work together. I know Dr. Martin has been really moving this forward in the CUGH network with this new working group on planetary health, One Health, and environmental health to really show the collective synergies. So I think the distinctions are really superficial in my view, and we can really capitalize on what they have in common. Great question, thanks.
Thanks so much, Catherine, and it's really, from CUGH's perspective, it's great to work with everybody on this call and a larger community as we pull in, as Catherine mentioned, the One Health, planetary health, and environmental health communities. So this question, Cheryl, I'm going to give to you, and it's from Riley. If you only had a few minutes with an elected official, what are the key things you'd like to say and points you'd like to get across to them to support the One Health initiative?
That's a great question, because I've been grappling with that. I've never been a very political animal, and so I know whereof I speak when I talk about getting out of your comfort zone to really make sure that lawmakers, policymakers really understand these policies. So what I would do is find they really respond well to issue briefs and talking points. So decide which talking points are really most important to you for that lawmaker. Again, context is huge. So you don't go in and hit them with the full scope of One Health. It's way too overwhelming. In fact, I was just going to chime in on Catherine's response to planetary health. Planetary health is so incredibly needed with trying to help us look at the human environment and an overall health process that way, but it would probably never really include things about human-animal bond or comparative medicine and translational research. So you kind of decide what your talking points are that you want to take to individual lawmakers. And zoonotic diseases right now, of course, are a very hot topic. We just led a couple of briefings here in DC a couple of weeks ago for House and Senate staffers and lawmakers. And because of the coronavirus, we had extremely good attendance, and they were really thirsty for, well, what is this One Health stuff and how do we make it happen? And that's when you have your opportunity to say, well, we could make it happen by making sure our laws allow our federal agencies to work together. So I don't know if, that's kind of a long answer, but I'm happy to share with you some of the talking points that we're developing. I'll have a message that'll be going out in the next few days, I hope, for suggesting things that individuals can do and preparing letters that could be shared with lawmakers. And I'm sure that this applies all around the world because we all have government systems that need to figure out how to do this.
Great, thank you very much, Cheryl. So we're winding down. We're going to just take a few extra minutes and give. We're going to go in reverse order. Cheryl, Catherine, and Sharon to each have a minute to close up, and then I'll have a few concluding remarks. But the one question I just want to get to before we close up, and for everybody online. This presentation is going to be online at CUGH.org, including the presenters' PowerPoints, and that's all will be open access for you to use and share with attribution. So the last question here before we get to the final concluding remarks comes from Nathalie, and Nathalie says, Sharon, I'm going to give this to you, what's the best approach to prevent negative attitudes towards wildlife in the general public to reduce actions that can be detrimental to species and conservation in the face of major zoonotic outbreaks, such as we've seen with H5N1 and COVID-19. We've seen animals getting killed, like bats and others, tragically. What can we do to reduce these negative, occasionally negative approaches, responses to wildlife in the face of an outbreak?
Wonderful. I love this question. So I think there's a few ways to approach it. The first is I truly do believe most of the 7.6 billion humans on the planet today do not understand what wildlife are doing for them. They do not appreciate this ecosystem service concept that both Catherine and I touched upon. And I really think the more that people do understand what these species are doing for us, will help us in minimizing that knee-jerk response of culling. The second part of that, I would say, is there are so many examples of culling not being the right answer. And we as health professionals want to do no harm. And we have seen with some of these approaches that have been taking, culling in particular, that we are doing harm. So if we can load ourselves up with those examples and have that as well, I think those two-pronged of why wildlife are important for your health, number one, and why reaching for these inappropriate, quote, solutions that backfire is number two. And then I think as some of the things we all three talked about is really appreciating that wildlife are not the bad guys, that it is our changing relationship in this global world of trade and travel that has really increased this ability for spillover. So I think if you approach it from those three areas, and as I think it was Cheryl who pointed out, know your audience and which one of those will resonate the best, I think that gives us the ammunition to really make people understand that those kind of, quote, solutions are not solutions at all.
Fantastic. Thank you very much for that, Sharon. So in closing, I'm going to turn it over to Cheryl. You will go first for a minute, and then Catherine and Sharon. Any closing final remarks you'd like to make?
Yes, my closing remark is always that, guys, this is urgent. We really can't afford to sit back, rest on our laurels, or sit on our hands. We really do need to get out and do what we can in our locations. And it's hard. It isn't easy, and it's very uncomfortable to put yourself in situations where you're talking to people where you don't know their backgrounds, you don't know their language, and you have to be sure that you can communicate. It's really not easy, but it's because of our intimidation of that process that we've really allowed our systems to push us into the silos. And these are systems issues, and this is why it's so incredibly important for the anthropologists and the social scientists to really be in the systems thinkers, to get involved with helping us figure out how to do this and get out of our comfort zones and actually do things that will help us implement One Health in a very real and practical way.
Thanks, Cheryl. Catherine?
Thank you so much. I think to emphasize that point that Dr. Stroud made about whatever discipline you're coming from, you can really have a key role in One Health solutions. And, if you're working on malaria, if you're working on maternal and child health and pollution, there's so many environmental exposures there that, you can really have a huge role in also expanding kind of the topics that have been covered under the One Health umbrella so far, and really teaching others how to lead on this. So I would say, the One Health community is all of us involved, and, the global health community is so key to that, and medical schools and nursing schools, and use the One Health approach to really benefit your work. I think it is exactly that, an opportunity, and a really powerful one to give you more tools on deck to really complement what you're already doing. But thank you again for the opportunity.
Thank you so much, Catherine. Dr. Deem?
Sure. I will close up. I want to just mention a few years ago, I gave a short talk at a global health conference at a fancy university with a lot of human global health professors, and I talked about animals and environments and humans and One Health. And the number of people that came up to me after my talk and said they never think about animals, maybe a little about the environment. And I just reminded them that their patients are either eating animals, living with animals, or animals are out there doing the ecosystem services to keep their patients healthy. And I think that's something we in the global health profession are coming to understand better. And I think that's really important how we've moved the dial in the last 10 years. And then lastly, I just want to add on to what Cheryl's answer with the politician, or my elevator speech. And I like to paraphrase the co-founder or the founder of Patagonia when he reminded us that there is no business on a dead planet. So I think that's pretty important. It might get the interest of a politician or two. And I'll just close by saying I really appreciate being on this panel with Catherine and Cheryl, and for your fearless moderating, Keith. Thank you very much.
Thank you very much, Sharon. And for folks on the line, as I mentioned, these fantastic presentations by Dr. Deem, Ms. Mashalaba, and Dr. Stroud will be at CUGH.org's website. And just to wrap up and say that, as a former politician, I can tell you we've got to engage and inform both the political policymakers and the public. The public moves the policymakers. And as was mentioned here by all three speakers, people do not know and are not aware that the living planet underpins our ability to survive on this planet. The planet provides the ecosystem services for us. It is our life support system, and it's being torn to shreds as we speak. The good news is we know what to do to address these problems. We have to get up and advocate for those solutions, and we have those solutions as we heard today. I'd like to thank very much, again, Dr. Sharon Deem, Catherine Mashalaba, Dr. Stroud, Cheryl Stroud, for being on this particular webinar that we have. I'd like to thank Jenna Smith in our office here, who does a fantastic job of producing it. And finally, I'd like to invite all of you to come to our conference in April 17th to the 20th here in Washington, D.C. You'll have over 2,000 people from around the world, and we have a dedicated half day, which is free to attend, on planetary health, One Health, environmental health, what we can do on the 17th. So go to CUGH2020.org and register for the Satellite Day on the 17th, and for our conference on the 18th to the 20th, if you can, and we look forward to seeing you there. Thanks for joining us at CUGH, and we look forward to seeing you next time on one of our webinar series.